last year um, with two other alumni.
Yeah. Well, now I'm an alumni and I'm coming back
Oh my
for a
gosh.
panel, so it's fun to see that you're back.
Yeah, what are you doing now?
I actually I'm applying to medical school and I just got a job in the ER as a nursing assistant, so
Cool.
going pretty well. So
Nice. Are you at Hogue or
I'm actually up in Northern California right now,
okay,
so I'm working at Sutter Health.
nice. In the Bay Area or Sacramento?
Yeah, Sacramento.
Oh, that's where I'm at right now.
Where at?
UC Davis.
Oh, I'm gonna apply to UC Davis.
Oh, okay. I'm actually at the med school right now, renting out one of the
Yeah. How
rooms.
is it?
I like it. I've gotten to know some of the med students from UC Davis. I think the family medicine program is going great so far. But yeah, it's really nice that the medical school is right in front of the hospital, which is
Yeah.
different because I went to UCI and our medical center was in Orange, whereas our school was in Irvine. So it's pretty far distance to drive.
Yeah. But yeah, I've been looking at UC Davis because I'm originally from El Dorado Hills, which is like 30 minutes.
Yeah, yeah.
So I've been looking at UC Davis, so that's pretty cool that I already know somebody there. That's nice.
Yeah, there's a lot of scribes that I have interacted with at the emergency department too. So if you're interested in scribing, um, there's an opportunity for that too.
Cool.
Yeah.
Well, if I want to do scribe, I know who to reach out to.
Hmm.
So unfortunately, it doesn't look like I'm able to go and present my screen, which is a little, it's a, it's a, it's a downside, but we should be able to continue the meeting as normal. Thank you very much for you guys being able to show up. I really appreciate it. Our club really appreciates it. We have a lot of students that are very interested in the medical field as well as the MCAT, and we're very grateful to have you all here.
Yeah, of course.
I wish you
Nice
could
to
see.
meet
I'm
you.
smiling, but you can't tell. Unfortunately, this is a new computer that I'm using because my old one broke. So, unfortunately, I cannot present my face to show you that I'm smiling. So, thank you very much for being here.
Absolutely. Should I start by introducing myself, or
Sure.
how do you want to start it?
That would be. I think that would be a great way of starting. Let's have a chance to have everyone meet each other. I This is going to be recorded just in case if you are any of you guys were concerned about that. We're going to be sharing this for students that might not be able to have made it to the Zoom meeting. So at least through this way, we'd be able to um, have people in an off-campus setting be able to participate. So yeah, let's start off with a bit of an introduction. So who are you?
Yeah, all right. Hi, everybody. Good evening. My name is Silvana Marquina. I graduated in 2017. So way long ago. I majored in biology and minored in chemistry at Vanguard. And I am now a family medicine resident at UC Davis. And I went to UC Irvine Medical School in 2019. And then I did a master's here at UC Berkeley between my third and fourth year. And now I'm living in Sacramento. Nice to meet you guys.
Amy,
I
would
guess.
you like to go next?
Yeah. All right. Hi, everybody. My name's Amy. I graduated from Vanguard in 2022 and in 2023. I got my bachelor's in biochemistry, and then they had the master's program for biotechnology. So I got that in 2023. And currently I'm just a lab coordinator here at Vanguard, so I just stuck around. But yeah.
Jacob, would you like to go next?
Hi, I'm Gina. I'm currently a senior here. So I'm going to be graduating next semester. Currently a bio medical major here. So I'm working towards graduating, and that's what I'm working towards, going to med school in 2026.
Awesome. And how about you, Jacob?
Well, my name is Jacob. I graduated in 2024, last May. I just took the MCAT this summer, and I'm currently working in the ER as a nursing assistant in Sacramento, and I'm happy to share any wisdom I have on the MCAT.
Awesome. Well, it's wonderful to hear from you guys. Thank you again for coming. Um, One of the questions that we could start off with is what made you decide to be in the medical field to start off with? What job or position in the future made you want to take the MCAT, if that sort of makes sense?
Yeah, I guess I could start off and then maybe Jacob has more relevant info. So I took the MCAT because I knew I wanted to go into medical school, and as you guys probably all are pretty well aware, that's the entrance exam to enter medical school. And I was studying around the time where it changed from a two-digit to the three-digit format scoring system, um, and where they also added the psychology, sociology portion that hadn't been there before. And my biggest, inspiration was my grandfather. He was also a doctor, and I knew that I looked up to him, and that's really how I wanted to also um, carry my life, and also, in a way, serve the Latino population. So that's always been a passion of mine, and it's been the same ever since.
Well, I've been thinking about this type of question a lot, preparing for interviews. Throughout my experience going from high school to college, I've had a few experiences in the healthcare field. I was originally a home health aide, and then I also served at Cope Health Scholars, the Health Scholar Program, and now I'm in the ER. And just throughout my time, like working through the healthcare system, I've been able to touch a lot of different people's lives. I really haven't been able to do much for like curing them or helping diagnose, but just being able to sit down with those people and like share some of my time. Most of them just need someone to talk to, and like that patient interaction when the person like smiles back at you and then you can realize that you're helping them in other ways besides that, it kind of drives me forward as I can help them more in the future. And that's just why I continued and why I took the MCAT this summer as well.
I'll go next. So yeah, the reason why I decided medicine, well, I feel like everybody has a dream when they're little to be a doctor, just to help people who are sick or like who are underserved. And I feel like throughout my high school experience, I was able to engage in a lot of different health careers. I shadowed a physical therapist before, an uh, dental hygienist. And I just see a lot, like in my community specifically, a lot of people don't have access to healthcare. And I feel like my goal that I want to do is help those people get the access that they can. And I feel like I recently, like 2 summers ago, I went on a missions trip to Ecuador, and it's completely different, the healthcare system they have over there. And it was so eye-opening to see how lucky we have it here in the States compared to them who are living literally in the Amazon, who have to travel so far just to even get like access to water or food that they could have. So, I mean, the goal is just to help people as much as we can for me. So,
The reason I got into medicine started when I was young, when my father had a lot of health complications, and it ended up very tragically. And then that just kind of sparked something in me to really help people, uh, like in my community, especially who are not seen as equal. to receive the same or equal treatment. And throughout middle school and high school, I faced similar health treatment and complications. And I saw how the internal medicine and how doctors are supposed to treat patients, and that I wanted to better the treatment of patients and of kids. And I began to shadow and work with doctors in my hometown, which was in an underrepresented community in a large state of California. And it really inspired me to want to continue doing that more. And so that's why I want to continue doing that into medicine.
Awesome. Thank you. One other question I wanted to ask as a follow-up is when you were deciding to go for your medical when you're preparing for your medical field, what would you say is the age group or specific group of people that you found that you wanted to touch upon and to be helpful for?
I guess I could go first. It changed a lot for me. Um, I knew though when I was going to some pre-med conferences, I learned a little bit more about the PrimeLC program at UCI, and I just felt like this is the perfect program for me. I program PrimeLC stands for Program in Medical Education for the Latino community, and I really felt that that's the kind of like training that I wanted. That's the kind of people I wanted to surround myself with. Um, and yeah, I also knew I wanted to um, work with lower income resource patients, and it's really opened a lot of doors, and I've got to meet a lot of amazing people in advocacy, as well as in academic medicine. Um, but yeah, I think it's a lot can change. But I think if you have the goal in mind and like the questions to ask people and figure out what it is that you want, and if it doesn't align, then it's a closed door, and another door will open.
Awesome. Jacob, what would you say was the age group or group of people that made you interested in being in the medical field?
Um, I think I don't really have an age group or like a typical like field that made me interested in medicine. I mean, I started in home health care, which was elderly patients and special needs. So I got to work a lot with like people who had disabilities and weren't able to do like daily tasks. I think that is what has driven me to keep going. Um, most there's a lot of people that can't help themselves or don't have the knowledge or the resources to get help. So I think that's where a lot of doctors and the healthcare system comes into play is to help those people who don't know about medicine or how to take care of themselves. And I want to help people figure out how to take care of themselves.
Well, that's great. Jenna, how about you?
Well, it definitely started with um, wanting to serve my community at first, the African American community, and it sprouted with definitely wanting to serve in the pediatric community because I started taking care of like a lot of kids, like in childcare and after school programs when I was young. So I definitely had a lot of experience dealing with kids, um, even with like special needs kids, kids who were in underfunded education programs, kids who were in lacked healthcare or were in Section 8 housing. So that definitely inspired me to work with pediatrics in the larger scale and hone more on underrepresented communities as a whole.
That's so cool. Actually, I'm also interested in the pediatric field, so it was really cool that you mentioned that. Amy, how about you?
Yeah, so like I stated, well, back where I'm from in Bakersfield, I feel like a lot of people aren't very educated when it comes to making doctor's appointments or like knowing and going to the doctor isn't a scary thing. I don't know why over there it's like people would rather not go to the doctor than cure themselves. So I feel like there's no specific age group. It's more of a community of people who don't really are not knowledgeable on how the healthcare system works that I would want to work with. Just because I feel like everyone should have access to healthcare, no matter their economic status or whether or not they, have some educational background. So I just feel like people who are underserved specifically is where I would want to work with.
Wow, that's actually really cool. Um, Getting on a bit of the topic with the MCAT, how would you say, using your experiences that you have all gone through in life, how would you say, whether it be your extracurricular activities or through your lives on how you guys were mentioning, how would you suggest taking experiences that you have personally found to be educating yourselves towards succeeding in both the MCAT and your preparations for medical school? Because I found that you guys all had a very interesting a story, and it was really interesting to hear. So, building off that, how would you find these experiences, and which experiences would you suggest to people to improve their chances of both getting into medical school as well as improving their scores for the MCAT?
Um, One thing I would say, obviously, I was a part of this club. We brought in a lot of people that were knowledgeable, and they did have a lot of great advice for getting into med school. I think this is probably one of the most underutilized resources for students, especially at Vanguard. Um, to help them get into med school. These people have already been through the process. And one thing that I always look back on is who have I met in my life that can shed some light on this certain topic, whether it's med school interviews or MCAT, stuff like this. And they'll be able to tell you exactly what's going to happen and how they did it. And you can change it to however you want to, but I mean, stuff like this, like these Zooms and like in-person meetings or going to certain, I know most colleges have like info nights on their med schools and stuff. So like you can go and watch those for pretty much free usually. And they'll tell you pretty much everything. Or you can get a like an assistance call with like an advisor or something, like a counseling appointment. So, I mean, there's a lot out there. You just need to be able to go and grab it.
Awesome. Jenna, would you like to go next?
Yeah, I would say, kind of bouncing off of what Jacob said, I would say networking is a very valuable skill to have into, you know, application wise and getting into med school. Because I know for me right now, it's very advantageous for me. Just going out and finding people, even if it's like researching like certain conventions of like academic conventions where they're having, even if it's like a Zoom convention where they're having an info session of how to do a mock interview or set up an MCAT like mock testing or how to set up your application or what classes you need to take or even applying to certain associations. Like even if it's like an association that you're specifically interested in, like I am currently involved in an association called the Black Women's Physicians Association. and they are a huge network where it's like a huge association where African American physicians help you get scholarships and funding and application help to get into med school, during med school, and afterwards. And it allows you to basically get your foot into the door and succeed on your way into the building. And I believe networking with those people and keeping in touch with those people definitely helps you get a better chance of succeeding your way through med school.
That's great. Thanks. For Amy, I know that you're doing some stuff in the lab. Would you say that that's being helpful towards your studying habits towards the MCAT?
I feel like it gives me more hands-on. I'm more of a hands-on learner, so it's easier for me to understand concepts when, you know, I'm working with it. So I have to prep a lot of the bio stuff. There's like the MCAT covers a lot of different techniques that you need to know. Um, would that be bio, OChem, biochemistry? And so I'm prepping out these techniques, these materials, and I'm like, oh, I know that. Like I know how this should run. I know that they're gonna do this, and then that will lead to them getting their results. Um, but I would also recommend like people who, are scared of networking. The AAMC provides a lot of resources when it comes to like info nights. They like send me a bunch of emails all the time, like, oh, we're gonna have this speaker talk about like they said mock interviews or like application preparation. So I would definitely recommend like looking over the AAMC website. Mhm.
Cool. And would you say, were there any specific people that you found that were really helpful towards doing that?
Um, Well, personally, I haven't had the time to do it. I'm like always running around in the lab, but I always will try to watch the videos like on the side, and it's really interesting because they just tell you step by step, like, oh, it's really important that you know your school that you want to go to, and like make sure you get like the background behind the administrators, because like if you get to know the people who are accepting of the applicants, then like you have like a one up into like getting accepted there, basically. So.
Yeah, right. Thank you so much. Was there, I know I only focused on the lab experiences. Was there anything else that you had mentioned or would want to mention?
I think that was it.
Awesome. Dr. Marquina, is that how I pronounce it? Okay, cool, great. Thank you for the nod. How about you? What were the experiences into getting your position? What would you say were the experiences and other events that helped you both prepare for maybe your MCAT, but also to becoming your MD?
Yeah, I guess practically speaking, uh, being a tutor, I think being able to like regurgitate the information to other students. I'm not sure if the supplemental is SSI, supplemental instruction.
Yeah, we have something similar. I think it's the SCI.
Oh, cool. Okay. Um, that was I think something that helped like help me retain the knowledge learned in general chemistry and biochemistry when studying for the MCAT. Um, I think also flexibility, that's another skill because the way you study for the MCAT is probably much more different than from when you studied for OChem exams or general chemistry exams. This is all new information, oftentimes that's presented to you, so you have very little time to like make a game plan. You're just presented with this new, I'm trying to remember 'cause it's kind of a long time for me too, but you are presented with like this um, uh, case or this like synopsis, and you have to read it really quickly. So it's a lot of um, fast critical thinking. So it's a completely different way of studying than you would for your regular exams. Um, and resiliency overall, because I remember the MCAT probably for me was the hardest exams that I've had to take up until that point. And then you carry it forward with you. And then I guess other skills like going into medical school is taking care of your body, taking care of yourself, because it is a lifelong learning career. You will never stop learning. And I'm only an intern, a first year resident, and I'm taking step 3 next week. So you'll never ever stop learning. You're always going to be reading new guidelines, and you always have to have a curiosity. Never lose curiosity in asking questions. And um, every day you're learning from patients, you're learning from your co-residents, and you're supervising attendings. So always keep that. And the best way is to like maintaining your health, sleeping well, um, eating healthy food. All those things are very, very important.
Well, thank you. And on the topic of tools, what would you say, what were the programs or tools or books did you use to study for for the MCAT exam?
I used primarily Blueprint Prep. It's a fully online course. Another student, Aubrey, she also was using Blueprint at the same time I was, so it was really nice to have somebody else from the same school using it, and we could kind of like take tests and break it down together. But I really liked Blueprint. They highlighted everything through videos, everything from genetics to the highest level of biochem, with like pictures and like graphics. So it was a lot more engaging than just learning it from a textbook. And as she said, the MCAT is a totally different beast than any any like class at Vanguard. I basically had to relearn everything for the test because of the way it's presented. You would get a passage, have to read the passage, answer 5 to 7 questions on it in a span of like 5 minutes. So um, just like the way the blueprint prep, they would space out the tests throughout your training, and then you'd be taking real exams, like 7-hour exams almost every weekend, to prepare you for the real-time test. Because if you could sit down and read it all day long, you could probably do fine, but it's that time constraint and that critical thinking part that's like almost probably like 60 to 75% of the exam is like thinking on your feet with like the information you've learned and pulling from all sorts of different. You could have a question on biochemistry that incorporates a biology thing and a uh, chemistry equation. So I think the way that Blueprint presented it for me was really helpful, and they also have the AAMC materials as well integrated into the course, so you use both of them at the same time. So that's what I used.
Thank you. And what did you end up getting? What did you guys end up getting for your MCAT scores? I should have mentioned that in the beginning. What score did you get from studying Blueprint versus your other MCAT score? Or did you only test once?
I only tested once.
Okay. What was your score?
I got a 504.
Nice. And then the meeting will end, but we'll reopen if that's all right with you guys. That way we can continue to talk. Awesome. And then, Amy, would you like to go next?
Yeah. So I primarily use the Princeton Review textbooks. I got like a bundle off of Amazon, and then I also was able to purchase the AAMC bundle. It came with a bunch of different questions for each of the categories, and it came with like 6 practice exams, like full-length practice exams. And I also was studying with a friend, so what we would do, we would go basically take some of the questions, we'd answer them like at our own pace, but then we'll come back together and be like, okay, so how did you feel about this? How did you feel about that? I think it's really good to have somebody to like talk to when it comes to this exam, because like then you're bouncing off ideas from each other. The only thing I would like change for in the future is I learn more hands-on, so I probably watch like videos on YouTube. I know YouTube has a lot of information when it comes to these topics that are very helpful, especially people who are visual learners, because it gets kind of tiring to read a textbook, so.
Yeah, that's a really good point. And then are you still waiting for your results from your MCAT? Because I think you mentioned that you took it earlier this year, right?
I took it during the summer. I did get my test score back. I got a 490.
Oh, nice. Okay, cool. Jenna, would you like to go next?
Yeah, so I used primarily the AMC bundle. I did the 2-year bundle, which had the physical copy of the textbook and then the online version of the mock exams and the practice sections for each set 4 sections that came included with it. That was very helpful for me because it was entirely accurate to what I was seeing on the actual exam. So I wasn't like misled by anything, especially when I took the mock exams. So I was timed correctly and not misled by the questions or the answer choices. Um, and it was very efficient for me to practice how to efficiently answer the questions and how to time myself correctly when answering the questions and how to answer them. I also did this with a study group, so it kept us all accountable for each other. So we had a schedule. I did this at 2 separate times throughout the year. So I did this once last year and once this past summer. Sorry, this past summer. Um, and so it was about 7 of us. And so we had a schedule out. We did practice problems and we did mock tests with each other. And so I took the exam twice. The first time I got a 496, and then the second time, most recently, I got a 518. So it was a much better time because the first time it was like a steady group of 3 of us, and then we expanded to 7 of us. So we had a big group. So the big study group helps with accountability a lot.
So is it sometimes difficult in order to have those types of long, prolonged study sessions? So having a big group helps you to kind of maintain that?
Yeah, the study group helps to maintain that because you feel accountable for your part because you're also helping your other group mates on what they're struggling with because you're all trying to attempt to get a high score because you're all trying to attempt to get into medical school. So you're not trying to like fail each other, especially because we were all friends. So you're not trying to let down your friends. That's, that's not your intent. So you're all trying to all get a high score. So it definitely helps with accountability. And because we all sectioned off um, sections of practice problems with each other, so we came back and we were discussing what we did, how we did it, and what we got wrong, and probably how we got it wrong. So and then we were helping each other through it. So we had to come back with something.
That's really cool. Um, because we're at 3 minutes, I think it'd be best if if we started the next meeting because then that way we don't cut you short. Would that work all right with you, Dr. Marquina? Or do you think you would have enough time?
Yeah, we can leave and come back.
Awesome. Okay. Then, Dr. Marquina, what would you say were some of the tools that you utilized and used in order to prepare for your medical school?
Yeah, definitely. I probably might be more old school. I don't know if Kaplan's used as much often, but that's what I used. That was kind of more popular when I was studying for the MCAT. And I did have to retake the MCAT, and it's become quite more common from what I'm hearing to take it more than once. I did um, the in-person classes at that were offered at UCI. And from what I remember, I think I scored a 507.
Oh, wow. Okay. For all of your um, letters of recommendation, who were the individuals that you talked with? And using it, yeah, who were the individuals that gave you a letter of recommendation? And if you wanted to ask for someone and give advice to people who have not gotten letters of recommendation yet, what would you say would be the correct people to ask? And who are the people that you asked?
I think it's different for everybody. Um, not It should be somebody you have a personal relationship with. That's going to give you a strong letter of rec into a medical school. I'm currently using a counselor to help me through the admissions process. And he has told me that the people you want to have on your letters of rec are the people you spent the most time with. So my advice would be to get to know 3 or 4 teachers and do shadowing hours to really get to know a doctor so they can give you a letter of rec. But those personal letters of rec from people you can know that are going to give you a good letter of recommendation are the ones I would recommend.
Nice. Jenna, did you have you gotten a letter of recommendation yet?
Yeah, I've gotten several. I would say, like on from Jacob, definitely keep it personalized. It definitely keeps a strong version of your application. I would say get as many as you can and keep it as personalized as you can, and try to branch out as your teachers, not to just keep it as just science teachers. Try to get it as like elective teachers, like I have one from like a women's studies teacher. I have one from a theater teacher. It's different ones that you have a personal background with. I have some that are not just from school, they could be people you've worked with, like an employer, or someone you shadowed over who has seen you work personally, who has seen your work ethic, your attitude, your apathy, your empathy, who has seen you personally, because that definitely shows your strength and your personal attributes on your application.
Okay. Well, that's nice. Amy, how about you?
Um, right now I only have the one letter of rec. I shadowed a cardio, no, sorry, a vascular surgeon about a year or two ago, and so I have that. But as of recently, I haven't had any more letters of rec. But I think the information that these two give out is really helpful. Like someone like me, I haven't asked yet recently. So I think yeah, keeping it personalized was probably the best route to go because you don't want to have a letter of rec from somebody who doesn't know you or your work ethic.
Nice. And finally, for Dr. Marquina, how about you? What were the letters of recommendation that got you into where you are right now?
Yeah, I definitely agree. I think you want to have someone who knows you really well that can attest to your um, communication skills, your professional behavior, and your overall reliability. And I think um, it also kind of looks like as a red flag if there isn't details on your like character, your personality, or details on a specific encounter that you had. Um, with the letter writer. I also did medical school applicant reviews, and I would look at applicant um, personal statements. I wouldn't ever look at scores because as like a student interview, you just want to get to know the applicant. Um, and looking through some of the recommendation letters, you could tell the ones that really knew the applicant very, very well because they would have specific stories or a specific example of this applicant. And those ones really are the ones that stood out the most um, versus the ones that they just talked kind of generally about the applicant.
Awesome. That was very insightful. Thank you. And then you all mentioned on certain aspects of shadowing, or at least most of you did. Um, for those that you did shadow, how did you get into contact with that individual and how did you shadow them? Or if that question sort of makes sense, I could rephrase it. Who did you shadow and how did you get into contact with them in the first place?
I could go first. So I shadowed a vascular surgeon, like I said, a year or two ago. And my mom cleans houses for a living, and so she was one of her clients, and she always has to say something about me and going to medical school. And the doctor was very kind enough to just let me, shadow her around for like a whole summer, basically. And it was actually a really great experience. It really got me to like really love surgery. It's very interesting, but it's also very it's difficult. So yeah.
Okay. Jacob, do you want to go next? If you want to.
Um, for shadowing, the first time I got shadowing hours was at Hogue. Um, just getting to know people around. You really have to put yourself out there. But I think most doctors, everyone that I've talked to, are usually they want to help the kids who are getting into the field. And I mean, it may seem scary to ask them, but usually they're super nice and all they want to do is help. If they don't let you shadow, they'll point you in the direction to someone else that you can shadow. Um, that's I'm gonna try and get more shadowing hours working in the ER, so hopefully I have more to come.
Nice. Jenna, have you gotten any shadowing hours yet?
Yeah, I got some shadowing hours this past summer. It was actually with my mom's ophthalmologist. I was went with her because she couldn't drive to her appointment back and forth. So I went with her and met her ophthalmologist, and of course she was talking about me, and I ended up talking about going to medical school and such. And he and I were discussing, and then we ended up talking and. I asked him if I could shadow him for the summer, and then that's how I ended up shadowing him for about 3.5 months, and that's how I got my hours in. And I plan to shadow him again, and then find some other shadowing hours. But you can find some other doctors just kind of around, not like around, but like at certain like kind of conventions or doctor's offices, like kind of just ask them because, if they know like there's your story or like what you're trying to achieve, they're more than likely willing to help you. Um, you know, help or they'll know somebody who is willing to help you because they definitely have connections to somebody.
Nice. Thank you. And then Dr. Marquina, what were the ways that you shadowed or have been shadowing in order to get to the position where you are right now what did you do?
Yeah, I did the same. I just would reach out to people that knew someone and just establish a connection. I shouted a pediatrician in Irvine. And I would love to, if you guys are interested, I have friends now that are still at UCI that would love to have students come into clinic. If you guys are interested, I can share my email or Joey, please feel free to share my email. I think everyone's on the email thread already has it. And then here in Sacramento as well, Jacob, if you're interested in shadowing someone else, would love to make that connection. I think at Vanguard was really hard because I didn't know anyone. I like didn't know any doctors. I mean, and my family, they're all in Peru. So I just had to um, just randomly message or email people. But you guys have a connection with me, so I would love to help.
Well, thank you. That was very kind of you. Thank you so much. I'm pretty sure at least a few of the students will be taking advantage of that. One of the other questions I wanted to lead into was um, through this, you mentioned the schools that you mentioned specifically. Was it ICU or
UC
UCI? Sorry,
Irvine.
UCI.
UCI.
Sorry, my fault. For those, was that the school that you also applied to?
Hmm.
Okay. Would you say that it would be best to shadow, or at least ask to shadow at the school that you're interested in going to, and that way it can also look better as for a letter of recommendation as well, right? Okay.
Yeah,
Was
I think.
that, did you get a letter of recommendation for when you were shadowing at UCI?
No, honestly, I think it was God's grace. I um, was able to start off in the conditional program, and then I matriculated into the first year. Um, but I think with med school, a lot of people end up going out of state and then coming back later, which is which happens a lot. But really, what matters, I think, is like getting into a med school, and you'll always find your way back into the state. But um, I think it really does help. I think shadowing within the school that you're interested in definitely does help.
Awesome. Um, Another question I feel like I should have asked a little bit earlier, but was regarding your MCAT. For all of you guys, what would you say were the topics covered in the MCAT? Not specifically like, was it broken up into sections? How did you guys see the material presented in the MCAT? And through that, um, what were the uh, classes that you think you could have either studied better at, or however you want to interpret that question? If that's helpful, then whoever would like to, they can completely start.
I can start if no one else does. It's split up into four sections. Um, Chem Phys, then it's CARS, critical analysis and reasoning, biochem, and then psych soc. I would say the hardest one for me was definitely OChem stuff. While it's not the most like specific prevalent, um, each section, whether it be chem phys, biochem, or even psych soc, they all integrate um, aspects of every single subject. So you could be in the biochem section and they could throw up an organic chemistry reaction. So I think just becoming well-rounded in all of them is the most important, and understanding how they all work together is extremely important because every single question could have multiple different subjects within it.
Yeah, yeah, that makes a lot more sense. Thank you. Um, with regards to on how these topics, for this could be for anyone that wants to tackle this. Um, when did you feel uh, through the classes that you've been taking through your undergraduate years? When would you say you felt you would be able to take the MCAT exam? Was it after you took biochem, or what classes in general would you say you need to have a good grasp of before you even attempt at taking the MCAT?
I think definitely biochem. For me, biochem was only offered every other year. So I had to take it after my senior year and taking all your gen eds, um, like your general chemistry, general bio, physics, calculus. Um, some people take it after their junior year, which um, can help set you up to apply for like right during your senior year. But yeah, it definitely does help. You guys probably know better than I do.
Well, yeah, thank you so much for that. That does give a better grasp on the timing of it. So thank you for that. Um, for finishing up on those topics, what would you say were your best study habits in school for studying for those kind of classes? Like for biochem, did you realize it was best to have uh, a visual diagram of how the reactions were taking place? In human phys, was it good to see a diagram of how um, the specific type of muscles were? Or if you took anatomy, having basically what were the tools that you used to study for those topics in school, and um, how would you have utilized those topics to study for the MCAT?
I think for me, especially because I was in a group, but also like individually, with specifically we're on like general chemistry, OChem, physics, um, those specific sections in biology, flashcards definitely help because you would need to memorize a lot of the equations because they don't give you the equations on the exam. You don't get to take, or they don't give you an equation sheet, so you need to memorize them, and they don't always give you the equation you need to use. So you would need to figure out which equation you need to use. So having those memorized definitely helps. So flashcards is a definite go-to. Also, having repetition of drawing out diagrams of certain pathways in anatomy, physiology, chemistry, um, physics, like force work, velocity, all of that definitely helps in terms of visual aids because they don't always show the picture of what you need to know. They'll just give you a paragraph of what they're trying to explain. So visual aids and flashcards was a definite help for me.
Well, thank you. And then we can also ask if I think that was a really good saying. So then, one of the last questions that we have um, would be if you could have, or if you could talk to your younger self. I know this is the question that most of the time all these panels will ask, but if you were talking to your younger self, what would you have either done differently? How would you have studied better to have better studied for uh, your first MCAT exam as opposed to the second time you took it? What were the things that you learned?
Um, I would also like to touch back on one of the other questions in conjunction with this one. I don't, Vanguard and the MCAT are two different things pretty much. I thought none of the tests at Vanguard really prepared me for what the MCAT was like. So I think if I was going back in time, I would probably like not like hardcore study, but start looking at the types of practice questions on the MCAT and trying to figure them out while doing like biochem, I guess. But I think I had to basically, you have to study for the MCAT specifically. It's not like you're just going to get there and I mean, maybe somebody can do this, but you're not going to get there and you're going to know everything that's on the exam and then you're good. You need to study specifically for the certain things that the AAMC is looking for, and you got to do it in a time pressure. So that critical thinking and then that's also like hard. So I would practice like one thing that I would say would maybe be critical reading of like scientific articles or like research articles or something like that. We did that a little bit in SERP, but not enough to where I would have said if I finished Vanguard and went straight to the MCAT, I would not have scored as well as I did. I would say critical thinking and reading things critically. So even when you're in your class, like if a teacher gives you an assignment on a scientific article, like don't just blow it off, you know? Don't just go through it. Really read it, try and understand it because the MCAT is going to be all the like every single passage is a scientific article pretty much. And you got to understand it. You got to figure it out, critical reason it. So I think that's what I would tell my younger self is to really critically analyze those scientific articles and get proficient in that.
Yeah, I have to agree with Jacob. Like, a lot of the tests that we experience while you're at Vanguard, it's kind of just like multiple choice and that's it. Where like the MCAT, it was like you have like what 95 minutes to analyze six different passages and you have like a minute and something for each question. It's like there's a lot of critical thinking, fast pace, like it's nothing I've experienced before, especially taking tests in my undergrad. So like if I were to tell my younger self, um, when it comes to studying, just don't be so hard on myself. Like I was trying to like do like two chapters um after work and it was like I was exhausted. So now I'm like slowly getting into it. Like I'm taking my time, but I'm also making sure I'm covering the topics I need to cover. I know the Kaplan textbooks give you like high yield topics that are expected to be on the MCAT, and I now would want to emphasize on that because my Princeton review books actually didn't give me the high yield topics. And so I feel like I was studying for things that, yes, were important, but probably wasn't important that they were going to put it on the test, if that makes sense. So,
No, yeah, that makes sense. Jenna, would you want to go next on how you would talk to your younger self?
Yeah, I would have to agree with Jacob and Amy that like the tests of Vanguard definitely don't help as much with the MCAT because when I first started practicing, it threw me for a loop, a very big loop. That afterwards, after having to do so many practice problems and mock tests, that I kind of learned that you actually overthink more than you really need to, and you're not critically thinking and reasoning as much as you need to. And you start rereading more than you really need to, and you're not actually reasoning more than you need to. You're not actually reading what you're actually supposed to be thinking. Um, and I think when you go through the passages that the first time you go through the paragraph, it's supposed to make sense to you and not supposed to confuse you. Um, I would say that when when you go through the passage to basically make an outline in your head of what it is and basically make kind of like a flow chart after you're done reading it. And that kind of helps throughout how to answer the questions because you're gonna get 5 or 6 questions based off of that one passage. And you don't want to waste 5 minutes on 1 or 2 questions because that's gonna ruin the whole test for you. That's what I would say because I know the first time of me taking it, it took a lot of time to just figure out what I'm reading for the first, 2 passages. So I would say, make a flow chart like in your head or write it down of what each paragraph is, simplify it into a reasoned statement, one no more than 2 sentences. So you have down what the reasoned statement is, I would say.
And I want to say one thing. It's not that you don't need all the it's like you need all the stuff that Vanguard teaches you. Like you need the basis of knowledge. Just the test itself is such a different beast
So
because
basically,
it forces you to use that knowledge in a more application way. It's not just what is photosynthesis or what is cellular respiration. They'll give you a specific part of cellular respiration and they'll say this thing is missing. Tell us why it's missing because of this ingredient, this. Like it's a different way of taking a test. It's not that you don't need you need all the information that Vanguard's teaching you. You're just going to have to apply it in a more specific way.
Yeah. I definitely agree. I'd say two things. Um, I probably would have, when going over my wrong answers, this thing I learned a little bit too late, but I wish I could have gone back through my wrong answers and thought through my reasoning. Why did I pick this wrong answer? And why did I not pick the right answer? And the other thing I wanted to say is the cool thing about the MCAT is that part of it is pattern recognition, which is really relevant in the future when you are seeing a patient in real life and you ask them the signs and symptoms, you see their labs, you see their imaging, and you see a pattern and you see it again and again and again and again. And if you're recognizing the pattern, you're able to come to the diagnosis a lot quicker. So that's kind of what the MCAT is testing you from an earlier age. But also the bigger component, I think, is the critical thinking. It's being able to be thrown a lot of information towards your way, but being able to synthesize what is it that I actually need from this passage that's actually going to help me answer the right questions and get through this question set and then move on to the next one. So it is a pretty ruthless exam, I have to say. I had like for me, I think the MCAT was probably like the biggest hurdle. I think like that and getting into med school, and it does get better because when you're studying for step one, for step two, step three, you're just studying relevant things that pertain to medicine. You actually won't use physics really that much unless you're going into radiology or if you're going into nuclear imaging or interventional radiology. Probably wouldn't use don't use general chemistry. I just used it today. But like biochemistry, unless you're like going to be going into toxicology and getting into the nitty gritty of pharmacology. So just know that this is temporary. The pain will pass with studying for the MCAT and it will get better.
well, thank you very much, guys. Unless you guys had any, do you guys have any other topics that you'd want to mention for anyone that might be taking the MCAT in the future or for applying to medical school? All right, then. Well, thank you very much for being able to talk for this topic, guys. I'm really appreciative of it. We're going to get this recorded as well as trimmed up in some areas. um, Thank you for putting up with the confusion with Zoom. Thank you for speaking, and thank you very much. And I ask that you guys all have a great day. Thank you very much.
Nice to
Thank
meet you
you.
guys.
Thank you.
Bye.